Your heart is one of the most crucial organs in your body, constantly working to keep you alive. But what if it's trying to signal that something is wrong? Heart disease can often present itself with subtle signs that can easily be overlooked. In this video, we'll explore 7 warning signs your body may give you if your heart health is at risk. These symptoms may seem unrelated at first, but they could be your heart's way of telling you it needs attention. The earlier you detect these signs, the better your chances of preventing serious health complications. Ignoring these warnings could lead to life-threatening situations like heart attacks or strokes. By the end of this video, you'll know how to spot these signs and what actions you can take to protect your heart. So, make sure to watch the video until the end, because it could literally save your life. 7th sign. Frank's sign. Frank's sign refers to a diagonal crease in your earlobe, and while it might seem like a minor cosmetic detail, it could be more than that. Studies have found a correlation between Frank's sign and coronary artery disease. This crease may indicate reduced blood flow or plaque buildup in the arteries. While not everyone with this sign has heart problems, it's been observed more frequently in individuals with heart conditions. Frank's sign can be a sign of aging, but if it appears in younger people, it's more concerning. It's not an absolute indicator, but it's a signal to take seriously, especially if you have other risk factors like high blood pressure or a family history of heart disease. Early detection through this simple physical sign could help prevent more serious heart issues down the line. If you notice this, especially combined with other symptoms, a medical evaluation is advised. 6th sign. Hair loss on the legs. While hair loss on the scalp is common, hair loss on the legs can be a less noticeable but concerning sign. Poor circulation, often due to blocked arteries, can reduce blood flow to the lower extremities. This lack of blood flow can affect hair growth. If you notice that your leg hair is thinning or disappearing altogether, particularly if accompanied by other circulatory issues like cold feet or a pale appearance in the legs, it may be a sign that your heart is struggling to pump enough blood throughout your body. Circulation problems can indicate that the heart is not functioning efficiently, leading to peripheral artery disease. Hair loss in this area is often gradual and easy to overlook, so it's important to keep an eye on these subtle changes. This sign is usually more apparent in men, but can also affect women, particularly those with diabetes or high cholesterol. If this symptom is present, it's essential to check for other cardiovascular risk factors. 5th sign. Xanthelasma on the eyelids. Xanthelasma are small, yellowish deposits of fat that can appear around your eyelids. These fatty deposits are often a sign of high cholesterol, which is a significant risk factor for heart disease. Although they are generally harmless and don't cause pain, their appearance could indicate an underlying issue with your heart or blood vessels. If you have xanthelasma, it's important to get your cholesterol levels checked and discuss heart health with your doctor. The presence of xanthelasma is particularly concerning if it appears in younger people, as this might suggest a genetic predisposition to high cholesterol. While cosmetic treatments can remove xanthelasma, they won't address the underlying issue, so a thorough cardiovascular evaluation is recommended. In many cases, changes in diet, exercise, and medication can help manage cholesterol levels and reduce the risk of heart complications. Keeping your cholesterol under control is key to preventing further damage to your heart. 4th sign. Senile arc. The senile arc is a gray or white arc that forms around the outer edge of the cornea in the eyes, often seen in older adults. This arc is made up of lipid or fat deposits, and while it's a common sign of aging, its early appearance could be a warning of high cholesterol or cardiovascular problems. If you notice this arc developing at a younger age or alongside other symptoms, it may be worth investigating further, as it could point to an increased risk of heart disease. High cholesterol is one of the primary contributors to heart disease, and these deposits in the eyes reflect what's happening inside the arteries. The development of a senile arc is often painless and slow, which makes it easy to ignore. However, its presence indicates lipid metabolism issues, which could lead to more serious complications like heart attack or stroke. This sign alone doesn't confirm heart disease, but it is a strong indicator that more tests should be done. Don't hesitate to bring this to your doctor's attention, especially if accompanied by other risk factors. 2nd sign. Leg ulcers. Chronic leg ulcers that don't heal properly can be a sign of peripheral artery disease, PAD, which is closely linked to heart health. PAD occurs when the arteries that supply blood to your limbs become narrowed or blocked, usually due to atherosclerosis. When blood flow is severely reduced, wounds or sores on your legs can take longer to heal. If you have recurring leg ulcers that don't respond to treatment, it could be a red flag that your heart is not functioning as it should. Ulcers can form due to reduced circulation, leading to tissue damage over time. In severe cases, lack of oxygenated blood can result in gangrene or the need for amputation. Early detection and management of PAD can prevent these outcomes and improve overall heart health. If you notice slow healing sores, it's crucial to address the root cause by examining your cardiovascular system and improving circulation. First sign: swelling in legs, ankles, and feet. One of the most alarming signs of heart failure is swelling, particularly in the lower extremities, legs, ankles, and feet. This condition, known as edema, occurs when the heart isn't able to pump blood efficiently, causing fluid to build up in the tissues. This swelling is often accompanied by discomfort, and the skin may feel tight or shiny. If you notice persistent swelling in these areas, especially if it's paired with shortness of breath or fatigue, it's critical to see a doctor right away, as this could indicate heart failure. Fluid retention can also lead to weight gain, which may go unnoticed until the swelling becomes severe. In addition to heart failure, other conditions like kidney disease can contribute to edema, so it's essential to determine the exact cause. Often, lifestyle changes, medications, or medical procedures can help reduce the swelling and improve heart function. Timely treatment can prevent further complications and improve your quality of life. Preventing heart problems. Now that we've discussed the warning signs, let's talk about what you can do to prevent heart problems in the first place. One of the most important factors in maintaining heart health is your lifestyle. Diet plays a huge role in keeping your heart healthy. Foods rich in omega-3 fatty acids like salmon and walnuts can reduce inflammation and improve heart function. Reducing your intake of processed foods, especially those high in sugar and saturated fats, can also help lower your risk of heart disease. Regular exercise is another key component. Aim for at least 30 minutes of moderate physical activity, like walking or swimming, most days of the week. Exercise helps strengthen the heart muscle and improves circulation, making it easier for your body to deliver oxygenated blood where it's needed. In addition to diet and exercise, managing stress is crucial for heart health. Chronic stress can raise your blood pressure and lead to unhealthy coping mechanisms like overeating or smoking. Mindfulness practices, yoga, and deep breathing exercises can help lower stress levels and keep your heart in top shape. Finally, regular checkups with your doctor are essential. Monitoring your blood pressure, cholesterol levels, and overall heart health can catch problems early before they become serious. Prevention is always better than treatment, and taking these steps can significantly reduce your risk of heart disease. These 7 signs, while subtle, can be early indicators of serious heart problems. Your body often tries to communicate with you through these small changes, and paying attention to them can be life-saving. You experience any of these signs, don't hesitate to seek medical advice. Early detection and intervention can make all the difference when it comes to heart health. The good news is that with the right lifestyle choices, such as a balanced diet, regular exercise, and stress management, you can significantly lower your risk of heart disease. Remember, your heart is constantly working for you, and taking the time to care for it can add years to your life. Don't wait until it's too late. Take action today and protect your heart for the long run. Thank you for watching this video, and if you found this information helpful, make sure to like, share, and subscribe for more health tips that could help you and your loved ones stay healthy.